your mouth holds so many clues to what is going on in your body.
I think women on average are exposed to around 150 different toxins just putting on makeup.
Wow.
A good oral exam can reveal signs or symptoms of up to 90% of systemic diseases.
So you said 90%? It can reveal up to 90%?
Correct.
Wow.
Yep.
The idea we can transmit cavities through saliva is just scary.
Yep, make good choices.
The cool thing is that our mouth is this window, right? It's actually showing us a peek inside of our body.
Yeah.
And how many people want to pay to go to the dentist? And how many people want to pay to go to the doctor? It's usually because they wait until something's wrong. And by then, it's really hard for us to get them back to a healthy state to repair that. Hello, and welcome to A Healthy Life Simplified, where it is our goal to simplify health and provide tools and information to achieve overall health and joy in life. This is episode 1 of our series of podcasts, where it is our goal to simplify health by building the foundation of the physiological effects on our body first, then define the tools and strategies to achieve overall health and joy. We believe that health and joy are achieved by a combined effort in all areas of our life, which include our spirit, our self, nutrition, exercise, sleep, and the choices we make around our careers, relationship, and finances. We'll explore these areas in these podcasts to help you look and feel your best, reduce potential disease and illness, and provide you with tools to build the life of your dreams. I'm Jessica Love, formerly Jessica Birrell. I'm a public speaker and educator on dental anatomy and dental technology, with over 24 years of experience. I'm known in the dental industry for my natural aesthetics as a CDT, creating beautiful smiles for actors, models, and the general public. I have the opportunity to work with dentists worldwide, and I would like to say I'm a mix of nerdy science combined with creative artistry. My passion for my career in dentistry and motherhood, I've really been able to combine and build my company, Capture Dental Arts, that I've had for over 14 years, and I've built it with my 3 children by my side. I believe in looking at health as a whole, and I'm so excited that looking at all the aspects of creating a healthy life is becoming a growing focus today. I'm honored to team up with Dr. Seibold. He's a functional medicine physician with Forum Health. I believe they have 27 locations now nationwide.
Yep, right around there.
Okay. Dr. Seibold is a humble guy, so he probably won't brag about how amazing he is, but he works hard to devote his career in getting to the root of disease, illness, and optimizing peak performance and health. He has a special interest in the body's innate ability for self-healing through the primary mechanisms of diet and lifestyle modifications, which we'll talk about lifestyle in our next episode. He specializes in autoimmune disease, cardiac, metabolic health and weight loss, hormone therapy, sleep medicine, and GI disorders. Dr. Seibold is a DO, and I will proudly leave it to him to cover all the physiological aspects of our body. I'd like to welcome him and thank him for joining me today, and I'll turn some time over to him so he can introduce himself as well.
Thanks, Jessica. It's a pleasure to be here. I'm excited to be here. I love talking about the body and how it affects our health, and especially when it comes to our lifestyle. I think sometimes in the traditional medical teaching, which I received. I went to school at Michigan State, and then went to residency in family medicine out in Denver, and then was board certified in family medicine, and went to small town practice in Idaho for a number of years. And after being in practice for a couple of years, I started to realize that a lot of the traditional model is really geared towards identifying illness and then deciding what treatment or which prescriptions will help to manage that chronic illness the best. And so for me as a provider, I just didn't find it as fulfilling to just be prescribing more and more medications. And that seems like that's what we did. It was always ironic that in medical school, we would go over or on the answer questions or in the answer keys to questions on our testing. If it ever talked about diet, lifestyle modification, exercise, those types of things, that was always the right answer. Yet we just didn't spend that much time learning about those things in school and practice. So after a few years, I started to look at some alternatives. In particular, I came across functional medicine and really just fell in love. It resonated with me and what I would want as a patient to try to get to the root cause of illness and to treat it from there. So I'm excited to be here. You know, the oral systemic connection is not something that I think, talk a lot about or know a lot about from our traditional medical training. But there's a lot of really compelling evidence and data that's been gathering over these years that really suggest how strong a connection there is between our gut health and our oral health. And talking about today is I'm excited to be here and grateful to be here. You got a beautiful studio here, and I love what you're doing, trying to bring this whole health to people and help them understand how their health is impacted by all these different aspects of life. So thanks for having me here.
Yeah, thank you for joining me. Today, we're going to discuss what your mouth is saying about you. As your mouth is the gateway to your body, it may hold visible warning signs that you could be at risk for disease. It can also show clues into your ethnicity, stress levels, and overall health. Let's take a deeper look at what your mouth is saying about you. So today we're going to start with the foundational link between the mouth and the body. Dr. Seibold is going to tell us why it's so important to understand the physiological effects on our bodies before exploring the tools and strategies. So first, we'll build the foundation on how our body works and how things impact us. And then we'll dive into tools to create overall health and how the oral environment, the mouth, is connected to the body. Our mouth, which is one of my favorite things to study, is dental anthropology. So dental anthropology study human remains, and the main thing that they have left intact is their teeth, as bones often deteriorate really fast. With their teeth, they have to tell that whole person's story, what age they were, what gender they were, their lifestyle, their diet. And so they're really able to take a look and say, what are our teeth telling about us? So teeth are actually really fascinating. Your mouth holds so many clues to what is going on in your body. We'll really dive into them, dissect them today, and maybe pay attention to what's going on in your body as we're listing out some of these common areas to study and understand. Dr. Seibold, I'll turn the time over to you now.
Awesome. So as I previously mentioned a little bit, you know, in medical school, we don't get a lot of training in regards to oral health. It's very, very basic. I do remember some lectures on oral health, and it really wasn't until I started looking into functional medicine and learning functional medicine that I really started to understand how our mouth really is the gateway to our body, to our digestive health, and how our oral health really impacts our general physical health. There's a lot of basic structures. I think we'll talk more about like the oral microbiome and biofilms and how these things impact our health. But there's a strong connection there. And I think it's great that we're teaming the traditional medical side of things with the dental aspect of things. Too often in medicine or in general health measures, we try to, partition things into different silos. If you have a heart problem, you see the cardiologist. If you have a lung problem, you see the pulmonologist. And we don't always, or I think we fail to recognize or see the interconnectedness between different body structures and how they interplay together. So I think this will be a good conversation today and will be very helpful for a lot of people.
So one thing we hear a lot of discussion about is our microbiome. And I hear a lot about it with our gut. You know, our gut health is affected by our microbiome. Our oral environment is affected by our microbiome. So Dr. Seibold, help us understand oral microbiome and microbiome in general.
Yeah, so that's a good question. Usually when we think of microbiomes, most people tend to think of their gut microbiome, right? But if you remember back in like 3rd, 4th grade, when you were in school and you were studying about biomes, there was like the Arctic tundra and the desert and the rainforest, whatever. And you learned then that different species thrived and did really well in different environments. And same thing in our body, right? We have different biomes or microbiomes that each have different pHs, different temperatures that all allow different microbes, different bugs to live and reside there. And we're starting to really understand how these different bugs can impact our general health and well-being now. So we know that our oral microbiome is the second largest microbiome or community of microbes in our body. The first is the gut, right? There's two primary surfaces in the mouth, the hard tissue and the soft tissues. These include our teeth, our tongue, cheeks, the gingiva, the gingival sulcus, our tonsils, the hard and soft palate. These all provide environments for microorganisms to grow and to flourish. So depending on the surfaces and the different adhesion molecules on these surfaces, different microbes are going to attach to different areas of our in our mouth. When these microbes attach, that coating is what we call the bacterial biofilm. And so there's certainly key factors there. Our temperature, the saliva pH, so our oral temperature should be around 98.6. We know that different bugs thrive at about 6.5 to 7 pH in the mouth. We also know that saliva is really important. It helps keep our microbes healthy. It hydrates them and acts as a transport medium of different nutrients to those microorganisms. So there's a lot of key factors to kind of take into consideration for the oral microbiome.
Yeah, and I think that a great way to summarize that for those of us who don't have a medical degree or don't quite understand still what microbiome is, the biofilm is the stuff we feel on our teeth. So, a great indicator is, especially after eating sugar or sweets, if you can take your fingernail and scrape your tooth towards the neck, towards your gum line, and there's something on your finger, that's biofilm, which is pretty gross. We all should have a healthy amount. But if we're going to talk a little bit more today on what creates that, and if you have an overgrowth, and what that could potentially mean if you are seeing something on your fingernail as you scrape your tooth.
Yep, perfect.
Okay, so tell us, how do we develop microbiome? Like, what is it composed of?
So our microbiome starts to develop at the time of birth or shortly thereafter. We are starting to see some evidence that perhaps it actually is developing while we're in utero still. But for the most part, if you think about how a baby's born, typically it's head first, and it's coming through the uterus and through the vaginal canal, which might kind of sound gross, but you're getting a big, healthy gush of tissue and fluid into your mouth, which starts to colonize your oral cavity.
So thank you, Mom.
Yeah, thank you, Mom. Moms do a good job there. So, and if you think about it too, babies that are born via cesarean section, there might be some health implications related to that because their oral biome, they didn't get that initial, dose of microbes that they should have had, or which is ideal.
That's interesting. Yeah.
Yep. And then after you take your first breath, we get microbes in through inhalation, and then with feedings too. The latching on to mom's to the nipple is going to also start to colonize the baby's mouth. We also know
is that more from a skin contact or the breast milk contact?
From skin contact, but the breast milk is also perfectly designed to help to feed those microbes. It has the right nutrients, the right pre-digestible fibers in it to help feed and to start to promote that healthy microbiome.
So microbiome is healthy, right?
Microbiome is a good thing, you bet.
Okay.
They should be healthy. And the problems that when they become unhealthy, that's when we start to see disease and illness.
So we know that we're growing this microbiome when we come into the world, from breast milk to air exposure to birth through the birth canal.
Yep.
But what is it really composed of?
Yeah, so our microbiome is composed of a wide variety of different species, right? We have bacteria, we have viruses, we have fungi, archaea, protozoa. All these different microbes, they colonize us. And for some people, we don't, that might be new information. That could be a little bit gross or worrisome. Yeah. But we know that we have these literally trillions of microbes that colonize and inhabit our bodies, right? There's kind of two main types of biomes, or microbiome, There's our core microbiome, which is pretty consistent throughout the body for most people, and then there's the variable microbiome, and that's going to be more person to person. That's really going to be dependent upon your lifestyle and also some pre-genetic determinants that are going to influence the growth or progression of certain species of bugs versus others. So
we inherit these bugs from our parents too?
In a lot of ways we do, you bet.
Okay.
And it used to be thought that the microbiome actually was what you're born with is kind of what you keep the rest of your life. But in reality, we're starting to see that there's a lot of big changes that take place. And especially in the person you marry and who you may share saliva with.
Yeah.
That can really influence your microbiome for better or worse, right?
There's and just commenting on saliva too. On the dental side, we study a lot, and there's still so much we're finding out on what is actually transmissible through saliva. But the idea we can transmit cavities through saliva is just scary. And I know for a while there, when I was out in the dating arena, like I just wanted to ask everyone in a very non-direct way, when the last time they had their dental cleaning. Because I'm like, I do not want to kiss someone that has this mouthful of cavities, because you can transmit cavities.
You bet.
And they're finding out all these other things that can be transmitted. So that's interesting to know that that microbiome can change depending on these different exposures, including saliva, spouse or whoever you're dating.
Sure.
Yeah.
Yep. Make good choices.
Yes.
I think with that too, as far as the what composes our microbiome, we know that we have commensal bugs, and these are the ones that are just living there. They're in this happy ecosystem. They're doing good stuff for us. We're providing a good environment for them to live and to thrive. But then there's also pathogenic bugs in there too, and it's estimated that there's about 5% of our microbiome, or our oral microbiome, is our pathogens, right? And so for the most part, though, our commensals are able to keep the bad guys kind of under control. But there are different instances, different lifestyle things that might influence or impact the outgrowth of those pathogenic strains. And then all of a sudden, when those pathogenic bugs are able to start to adhere to the surface, that's when we start to really create problems in our mouth.
Yeah, see breakdown in our mouth and in our body.
You bet. Yep.
All right. Okay, so we've talked a little bit about what microbiome's composed of. Did we capture all those areas of microbiome and what
Pretty
it's
much.
composed?
I mean, if you look at most of the studies have been done on our bacteriome, so looking at the bacteria. The next probably largest subset of studies have to do with our fungal microbiome, our mycobiome. That's certainly less known, but then as far as like viruses, protozoa, those others, we know less and less, but the bacteriome, the bacteria for the most part, are the ones that we've done most of our studies and research on, and what we know the best about, I think, at this point.
It just sounds like we're growing mushrooms in our mouth when we think of fungi. Yeah, it's definitely fascinating to know that we have these good and bad bugs in us, and that they're important. As long as we keep the bad ones at bay, these healthy microbiome, that's important to keep that. It's like an ecosystem, right? That is important for us to keep this healthy, if that's a good way to define it.
Exactly the way to look at it. 100%,
Okay.
Yeah.
Okay.
And that's the key thing to understand, is that these bugs do good things for us. They're not just there as happenstance. And we're starting to understand more and more how when the ratios and the diversity and the general abundance of these microbes is not where it should be, how that's impacting our health. And you see that, I think, a lot right now there's certainly a much bigger push now in traditional medicine to say, hey, all these antibiotics we're giving people, we really need to be judicious in our prescribing them and really make sure, do people really need these? And are we giving them the most well-suited ones to treat whatever illness we're looking at, right? So that we don't just go in and blast everything with the strongest, biggest antibiotics, because it does impact our health.
Yeah.
So.
Yeah, we're finding that out with mouthwash and toothpaste too. That, some of them are so strong they go in and kill the good bacteria in the mouth. So they may sting and burn and give you this great minty sensation, and your mouth may feel clean for a moment, but 30 minutes later, the bad bacteria has grown at an even faster rate because you just wiped out some of the good bacteria. So bad breath comes back at an accelerated rate. And so we're realizing that, some people totally disagree with mouthwash. We can talk about that a little bit later on, like coconut pooling and other options out there. But we do have to be respectful to this healthy bacteria in our mouth. And if we're not careful, we can destroy that and cause all kinds of problems, including bad breath, which is something none of us wants to have. Luckily, we can wear face masks a lot in the dental industry, so we can mask that a little bit.
Sure.
But not all of our patients.
We don't wear them in my job very much, though. Can't hide as well.
Yeah. So Candida, am I saying that right?
Candida, yeah.
Candida, yeah.
Candida. I always just say Candida.
Potato, right?
There you go.
So Candida is one of those things that we talk about a lot, I guess, in like medical medium. I think we touch on it a little bit in the How Not to Die book. But, I think it's one of those things that's often misunderstood, because I know when babies get thrush, or even when we see these white patchy overgrowths in the mouth, a lot of times we contribute to that, to the overgrowth of Candida, which is typically treated with the antibiotics, which we were just talking about can be really harmful because it's killing the good bacteria. One thing we thought was interesting when COVID hit, I think it was when the second round of COVID hit. I know myself personally, I got hit really hard with it. I had COVID, had kind of that cough, it lingered for a couple weeks, and then I got another exposure to it, and that just did me in.
Yeah.
But I started to develop, and my children, these patches, these white patches in the back of our throat that looked like strep throat. However, we tested negative for strep throat, and no one could treat these. No one knew how to treat these until I actually spoke to one of my dentists, and it looked like it could be an overgrowth of like a fungi, like maybe Candida. And so it was diflucan, I think is what they gave me.
An antifungal?
Antifungal, and it cleared it up right away. But we were constantly having these bouts of this almost white blisters in the back of the throat that would rupture, cause these sore throats. And when we went to the Instacare for it, they said they were seeing this with all of the new COVID strains that they were seeing. So interesting that it was a fungi. It was just an overgrowth of it, but it would keep cycling through. So every couple weeks we would see it resurface. So yeah, it was definitely a weird strain. Yeah.
So Candida it's endemic, right, in our microflora. It's there. It's just, again, it's kept under control by the good bugs, right? And so you got COVID, it takes a toll on your immune system, you get sick, and then all of a sudden it's like the jail guards are gone and the prisoners are ready to break out and take over, and that's what sometimes yeast does, or Candida, right? So
so it's interesting looking at it now from this perspective. How can we feed the good bacteria then? How can we feed that to keep the bad bacteria at bay?
So there's a lot of important things to do when it comes to feeding the good bacteria. Probably the biggest thing is our diet. What are we feeding it? When we see people with these highly processed, refined sugars, high sugar diets, those are feeding the bad guys, the bad bacteria, which ultimately allow for them to start to overgrow. And so having a diet that's rich in vitamin C really helps to promote healthy gums. If you have lots of vitamin D and calcium, it's going to help promote healthy bone structure. You want different, diets that are high in polyphenols. Polyphenols are what we find in the bright colored, kind of vibrant looking foods, right? These polyphenols help feed the good bacteria, which help promote our, healthy immune function. So.
Yeah, I thought that was interesting. I was actually just watching a YouTube video the other day on vitamin C and the link with good breath, like just how to have healthy breath. And the link that they found with vitamin C in oral health, like vitamin C plays a critical role. And it's not something that you can usually just take a supplement, a vitamin C supplement. There are some types of supplements I understand that are better than others.
Sure.
Yeah, I don't know if you can touch on that because not all vitamin C supplements are the same, but also eating fresh fruits and vegetables, especially your greens and your high vitamin C containing fruits and vegetables really affected the mouth and how that the microbiome, the healthy bacteria, bad breath, and reducing things like periodontal disease.
Sure. I think back when you're talking about vitamin C and its effects on us, I think back to some like the early colonizers, and I think they called them limeys, right? Because if they didn't have limes, which contain a lot of vitamin C, they'd get scurvy and bleeding gums was a very common symptom of that, right? So my preference whenever it comes to supplements, or I shouldn't say supplements, but more vitamins, minerals, is that if we can get those through a healthy diet, that's always the number one place to get it, right? There are good supplements out there that can be tested and proven and have the kind of the industry backing that they are what they say they are. So I don't know that I have one specific as far as vitamin C. I mean, I usually would encourage people primarily through fruits and vegetables to be getting that.
I feel like the raw, fresh source is always the best. Anytime we dry it or turn it into powder or juice it or whatever, we're still losing part of the components of that whole fruit and vegetable. So supplements are still better than nothing if that's the only option. But I'll include in the link also the video that I found on vitamin C. It had some interesting studies. It did talk about scurvy and some of the different supplements out there. Those some vitamin C supplements that were not as effective, and some recommendations on some that are more effective. So, there's, talking about food and things we can do. Eating a diet high in sugar, refined carbs, high alcohol intake, can really weaken the immune system. If you have a weakened immune system, oral contraceptives, diabetes, and high stress, they all contribute to that biofilm growth. So it's fascinating to know that if you are stressing, short periods of stress. I love Dr. Andrew Huberman. He talks about stress, that stress is actually good for us in the right amount of doses. It's when it's long-term and extended for over long periods of time, right? That it can become unhealthy. How we approach stress is important too. If we look at it as a horrible thing, or if we look at it as an exciting thing that's conditioning us and training us and strengthening that muscle. But if we are undergoing stress, we are changing the way that biofilm actually grows and produces in our body, along with sugar. Like sugar, I think hands down is the best test to see how biofilm produces in your mouth. Like if you have a dental cleaning, your teeth feel nice and squeaky clean. If you want to test that, eat something sweet, eat something sugary, artificial sugar, candy, whatever. Soda is a good contributor to that. And like I said, do that finger test, scrape around your gum line, and you will see very quickly what increases biofilm. But also being mindful of stress. Stress can really play a toll on our body, and those signs are visible in your mouth. And if they're in your mouth, they're in your body. Yeah.
We look a lot at modifiable lifestyle factors in functional medicine, right? And stress is one of the big five that we look at. And it's exactly what you said, that stress in small doses is good. If I want to strengthen a muscle, I gotta break it down a little bit through some stress. But if I go do the same exercise every day at the gym, that muscle is never going to have a chance to recover. And so in our bodies, this is a process we call hormesis, where actually that stress actually optimizes our health. And so learning to have healthy amounts of stress without this chronic day-to-day stress in life, I think is really kind of the key, because stress is ultimately does what makes us stronger, makes us better, but day after day after day, it breaks us down and causes other big problems for us.
And we will definitely dive into that more in our next episode, discussing our lifestyle. Because there's a lot about our lifestyle that can contribute to stress. We'll get into that in a whole other episode, which I'm really excited to talk about.
Yep.
Okay, so we talked about the composition of microbiome. We talked about the foods that can feed the negative, that bad bacteria in the mouth. Is there any other things that we need to understand about microbiome? I think we have a really good foundation now on what creates it, how we gain that good and bad bacteria, how we can feed the good and feed the bad if we're not careful, right?
Sure. Yep. I think the only other thing I'd say, and this just has going back to like the functions of the oral microbiome, right, is that number one is it helps to maintain oral homeostasis. Our bodies love to be in the same condition. We don't like change, and I think that goes for most people, right? So having a healthy microbiome maintains that oral homeostasis, helps prevent development of disease. It also helps with digestion of food and nutrition. The production of energy is influenced by our microbiome. The differentiation and maturation of our mucosal surfaces and our immune function are very much impacted by our microbiome. Certain bugs can detox different chemicals or heavy metals, things that we're exposed to that other ones can. And so they can be helpful in that regard for detoxification too.
So our microbiome's helping us detox.
In a lot of ways it can, you bet.
That's interesting, yeah.
So the key is to understand is that we need bugs in us. We just need the right ones and keep out the bad ones to help to have a healthy life. So
it reminds me of the Matthew McConaughey, feeding we all got two wolves on our shoulder, the good and the bad.
I've heard that one. I've heard them, yeah.
Right? It's kind of like with your microbiome. It's really easy to feed the bad if you're not careful and neglect certain areas in your life, like your lifestyle, your stress, and your diet for sure. So we just have to choose which ones we want to feed,
when life
right?
gets tough, it's like no more sleep. Diet goes to the toilet. We
that
just
funny?
lose
It's
those
so
things
easy.
that really keep us going well. So.
Yeah, I think our mouth is definitely victim of that first, right? Like, because when we're under a lot of stress, what do most people do? They start eating bad things, or maybe they're not brushing as flossing as much as they can, and just the stress overall, how it's changing that oral environment. So our mouth is definitely a good visual indicator on what's going on inside our body. And I think the first place where that health starts. Yeah.
Yeah. 100%. The mouth is the gateway to the gut, right?
Yeah.
Our gut is just a hollow tube from our mouth to our anus, but it starts in the mouth, and that's where things really matter.
Okay, so let's talk about toxins and chronic infections. I know, Dr. Seibold, you have some interesting ideas and concepts on toxins. There are just some great things to help us understand how toxins and chronic infections affect our body.
Sure. So when it comes to toxins, every day we're exposed to tons and tons of toxins, right? There was like a headline on a mainstream magazine just a year and a half ago talking about how every day, I think women on average are exposed to around 150 different toxins just putting on makeup.
Wow. Oh.
And that's not even talking about where we put our mouth, but toxins around us. We live in a very...
Dang, mascara is so addicting. We can't live without it.
Yeah. So we live in this toxic world, and it's not just social media toxic. It's, what we're putting in our mouths and in our bodies is toxic, right? So
yeah, and not to interrupt you too. I went through this whole stage in my life once where I'm like, I'm going to cut out all the toxins.
Yeah.
I'm going to cut out all the toxins in my food. I'm going to be as alkaline as possible. I'm going to try to reduce any potential risk for illness and disease. And it was awesome, but it is very, very challenging to eliminate
today's world is hard.
all toxins.
You bet.
Because even if
They're
say
everywhere.
Yeah, even if it's 100% organic, there's still ways of sneaking them in.
Yeah.
Anything you clean with in your home, even the clothing, like the how it's made, there can be toxins in there.
Sure.
Certain types of carpets and fabrics in your furniture. So you get to this point where it's like you become so paranoid, you just need to move out into the middle of the wilderness, away, far away from everyone. Yeah. Well, depending on what the tent was made out of, right?
True.
Like it is really hard to eliminate all toxins, but there's definitely a lot of things that we can do. So I thought that was fun when I was trying to achieve this great success in toxic elimination.
Sure.
Everything in moderation, I've learned.
I think so. And I'll say, fortunately, I think our bodies are pretty amazing and adept at dealing with toxins. I mean, I think we were made that way. Can we handle the whole load all the time? No, there's times when the toxins build up and they become problematic for us, for sure. But for the most part, our bodies are pretty amazing at dealing with these toxins. But not to say that we shouldn't try to minimize them as much as we can, right?
Yeah, for sure.
So when I think about oral health and different toxins, one of the common ones that we see with people are just different fillings, different amalgams, right? Silver and mercury amalgams. These can be toxic for some people. In particular, they off-gas mercury. And for some people, their detox pathways work really, really well, and they don't struggle with that. But other people, they might struggle, and those heavy metals, they can start to build up in the body. So there's organic and inorganic mercury. We know that inorganic mercury is actually a neurotoxin. And that's the primary form commonly used if an amalgam contains mercury, that's the typical form that's containing, right? And so recently the FDA even came out and said that fillings are not good for or should not be used in pregnant women, babies, children. I'm not sure why that doesn't include you and me.
Yeah, but I thought that was interesting too, because I was trying to do some research on amalgams and see what has been approved and not approved, because we know it's been a battle since, I think it was the 1800s early. It's been a battle for a while.
Long time.
On is it healthy, is it not healthy? So it is fascinating that they did just come out and say pregnant women, babies, we don't usually put amalgam fillings in babies.
Sure.
But the risk with pregnant mothers, if you have amalgam fillings, like it is them acknowledging there is a risk. Yeah.
Well, and I think the key is to understand is that, a lot of people can detoxify it and get rid of those, neutralize those toxins and get rid of them. But some people really struggle. And we see in our practice a lot of people with chronic fatigue, joint aches and pains that have really been around and around to different doctors and really can't get answers to their solutions. Sometimes it's because of these toxic metals that are building up in their body. Another common one that we sometimes see is going to be apical infections, right? So infections right around the root of the tooth. And so we most commonly see these with root canals. Root canals could have the potential, there's a lot of great root canals that are done, but have the potential to introduce bacteria into that space. And if you think about a root canal tooth, this is a tooth that is basically devitalized. It's dead, right? It's lacking the nerve supply to it, the lymphatic system to it, the good blood supply to it. And so there's potential for infections to develop in these spaces, little abscesses that that can have kind of systemic manifestations. You don't always feel it right there.
Yeah.
Again, there's no nerve supply there. You can't feel the infection there. But we've seen people very commonly, and you see stories of these all the time in medical journals of people who will, maybe they've suffered with joint aches and pains, rheumatoid arthritis, like significant arthritis, and they go and they have a root canal removed, and literally within weeks, it's like, all my joint aches and pains are gone. It's like, you healed me, doc. Like, what happened? Thank you so much.
Pulled a tooth.
And it was this underlying little abscess there. And is this for everyone? No, there's a lot of good, a root canal should be done sterilely in a very clean, sterile manner to help reduce any risk of introducing infection. And root canals can be necessary, needed. You know it's better than me, but
I think
sometimes it could be problematic.
Yeah, I think root canals are it can be a sensitive topic in dentistry because it's to extract or to do a root canal. And holistic dentistry really looks at it that if you have one root on that tooth, like your anterior teeth, and now you just got an infection in that pulp cavity, that's the life flow, the blood flow to that tooth, and you're going to place a root canal in there, you're essentially going in, cleaning out the life flow of that tooth and putting a plug in it. So now it's no longer getting this blood flow. And with that blood flow, it allows the tooth to get rid of infection, fight off that bacteria, and now it no longer can do that. So if they do it in a sterile way and it's clean and they've eliminated any potential bacteria in that canal, it can be done well. Sure. But there are a lot of studies out there that do show over time these teeth are no longer able to clean themselves out, right? They're not able to fight off bacteria. There's no life force going into these teeth. So it can harbor bacteria. And so I know that one extreme of holistic dentistry is not to do root canals. It's just extractions. But then to extract a tooth and go through an implant, you're risking some potential bone loss depending on the skill of the doctor. And I would say most of the time you are still at risk for a little bit of bone loss when you place an implant. Your tissue may change shape if it's not managed well during extraction. Sure. And if it's a tooth in the front of the mouth, I've thought about this myself personally. If I have to get a root canal in my central, the tooth in the front of my mouth, am I going to extract it and put in an implant knowing it could harbor bacteria, or am I going to get a root canal? And that's a tough decision for me because aesthetically, it's really challenging to put a root canal or to place an implant in the front of the mouth and have tissue and bone and everything maintained perfectly. It is possible, but it takes very skilled dentists to do something like that. So on the other hand, would I get a root canal first and then just see if I stay healthy? And then when I'm starting to find these symptoms that I can't figure out what they're linked to, do I pull the tooth then? So I think it's a personal choice, something to talk about with your doctor.
Sure.
If you are experiencing, some of these symptoms that he was mentioning, and you do have root canals, it could definitely be a culprit of it. Another thing we can do is CBCT scans.
Yeah.
CBCT scans are a little bit different than your pano x-ray. We can actually pan into the bone and look at the different levels in the bone and look for infections. And you'd be surprised, a lot of old root canal teeth do abscess or become infected over time. And we see that. We see that on these CBCT scans. Sometimes we don't always see that on traditional x-rays. So we've actually seen a couple cases of that the recent last week. A gentleman just had an injury to a front tooth and didn't realize that it had abscessed at the tip of the root, and that infection had nowhere to drain. And he had no side effects, no symptoms. He knew he'd injured his tooth, but here when we took this CBCT, we found this infection that was just trapped inside the bone without anywhere to go. So, to root canal or not to root canal extract, like I said, it's kind of like religion. We'll let you choose what's best for you. But I definitely say consider if you are having a bunch of health side effects, like negative side effects, that you're having a hard time getting to the root cause of those. Work with Dr. Seibold or, a functional medicine practitioner that's actually going to take a look at that and take that into consideration, because studies show that there have been significant reduction in some of those symptoms because of root canal teeth when they're extracted.
Yep.
Yeah.
Yep. Yeah. For many people do really well with them, and some people sometimes you get bad outcomes too. So just something to keep in mind, I think. And like you said, I'd probably go forward with it, and then I'm going to watch closely how I'm feeling.
Yeah.
And if I'm having issues and troubles, then we need to take a deeper look.
Yeah. Sometimes, with a molar, they have multiple roots. So if some of the other roots are vital, maybe it will be okay. So like I said, it's kind of a religion. I'll let you decide which side you're on there. Holistic dentistry, I do believe a lot of those principles. But if it were myself, like I said, I might wait a little bit and see how I do. Okay. So, so we're talking about how the mouth is really the gateway to the gut. I think it's important to touch on chewing food. And I myself, sometimes I'm in a hurry and I realize, what did I just eat? Because, I ate so fast, I wasn't even thinking about what I was doing. And why is it important to slow down and chew your food?
So there's a lot of good reasons. I think number one is just the mindfulness of the experience, and people that tend to be more mindful in their eating tend to eat less and have healthier eating habits, right? Yeah. But as far as like our oral structure, mouth, right? The really digestion begins in the mouth. It has to do with having good dental anatomy, so we can chew our food properly and appropriately. We should be chewing food probably 30 to 40, maybe 50 times per bite, kind of depending on what you're chewing, right? If you're chewing a piece of steak, you should chew it up as much as possible to really start to break that down and to prepare it for further digestion down in your stomach, right? We know that as we chew and as we salivate, our stomach starts to release hydrochloric acid, and that's what helps to digest food and to break it down into smaller particles where it can be better absorbed into the body. People that don't chew adequately have higher rates of heartburn, digestive troubles, overeating. They have poor absorption of nutrients into their body, and just in general, just don't enjoy their food as much as those who do. So chewing is certainly the beginning, and that's the primary function of our mouth, right?
Yeah, I think especially with technology and social media and the internet and everything, how many of us sit down and eat and are catching up on emails and texts and checking our phone, checking social media, whatever, instead of actually stopping and focusing on the chewing and the breathing in that moment.
Sure.
And I know I've tried to be mindful of that. There was one time in our life that my son was actually trying to get the 30 to 50 chews in. And so you would see him just sitting there counting when he was little. He was probably 5 or 6 years old at the time. And we all got so annoyed with it because we're like, just swallow it already,
Finish.
Right?
We won't be done.
But it actually, studies really do show that the longer you chew your food, the more nutrition you absorb out of that. Less intestinal gas and air is swallowed. Like I said, it's fascinating how some of the nutrition really starts to begin that absorption process in the mouth. And I've read some fascinating studies on that of how it's not just in the gut, it's not in the stomach, like it starts in the mouth, especially when introduced with saliva. Yeah,
healthy saliva is also one of the key factors of our mouth, right? We should have adequate amounts of saliva. And then as part of that saliva, we have different digestive enzymes, amylase, a little bit of lipase, also mucus. That all helps to start the digestive process. The mucus helps to coat the food and allow us to swallow it more easily. And so, saliva, healthy saliva is really key to, also critical, I guess, to having good starting digestion in the right direction.
Yeah, I wanted to touch on that too, because if you've gone through chemotherapy, that's a big problem because it does deplete your body's ability to produce saliva. And I was reading some studies, and I'm happy to put some studies in the link below as well, on if you've gone through chemotherapy, what can you be mindful of? And you can retrain those salivary glands to be stimulated and start producing saliva. But in general, they were saying that it's common to have that interruption for up to 12 months. Wow. And during that 12-month period, your teeth become very dehydrated, which can cause breakdown. And we see a lot of graying in teeth. And sometimes that graying in teeth after chemotherapy is so extreme that it requires crowns and veneers to cover them back up again so that they have a nice, vibrant smile, because it just dulls down their whole smile. So chemo can be really hard on the body, but be mindful if you've gone through chemotherapy, especially if you're getting ready to go through chemotherapy, you'll need to do extra things to help produce or encourage saliva production, because it will definitely be affected. Most chemotherapy patients suffer from a reduction in saliva.
Yeah, so I just remember I had a patient in my last practice in Idaho, and she started having all these dental problems. And she said she went to the dentist, and all of a sudden, after years of never having any cavities, she had like 10 or 12 cavities, like a ton.
Yeah.
And so we started looking at her mouth and did some testing, and come to find out, she certainly had autoimmune disease, Sjogren's syndrome, where she just had very poor oral production of saliva. And we see this very commonly too in people as they age. I took care of a lot of nursing home patients in my last job too, and very commonly dry eyes, dry mouth was a common thing we were treating. And so we'd have to help people with different sialagogues, they're called, to help promote more saliva production and to help them be able to chew, eat their food, swallow their food better, and also to maintain a healthy microbiome.
I know there's some healthy mints out there that are available too. I actually just spoke to a dental patient that suffered from dry mouth because dentures can really encourage a dry mouth. And so your lips can get stuck on these dentures and have a hard time sliding over your teeth when you talk. And they're mentioning there's different mints out there on the market that are natural mints that you can place in your mouth, and they'll slowly dissolve over time and help encourage that saliva production as well. Is there anything we need to touch on too, that like dairy consumption increases that mucus production? Could that be destructive at all?
I think that it can. I think when you're talking about dairy consumption, I think the trouble I see, especially in my practice, is that a lot of people have sensitivities to dairy. And I'm not just talking about like lactose intolerance, where you lack the lactase enzyme to properly digest milk sugar, lactose sugar. I'm talking more about actual sensitivity to whey or casein proteins or other proteins in the dairy products themselves. I know for myself individually, when I have a lot of dairy, I'm lactose intolerant, so my family doesn't love that. But I'm also, I get drier mouth, especially if it was in the evening time. At nighttime, I'll wake up a lot of times at night with a dry mouth because I have a hard time breathing through my nose because of the increased mucus production and inflammation going on. And so I think when I started to make the connection that, I'm producing more mucus because my body's trying to protect itself from the inflammation that's being driven by the dairy. And not to say that dairy is bad for everyone, because there's plenty of people that tolerate dairy just fine. For me individually, and I know for many of my patients, sometimes dairy can be one of those triggers, one of those foods that we have some sensitivity to, and as we consume it, it drives inflammation, and then inflammation is ultimately what leads to illness, right? Inflammation is actually a normal part of our immune function, kind of like stress.
Yeah.
We just want a little bit of inflammation, not chronic inflammation. And that's when we start to get problems, is when it's chronically high. We're chronically inflamed, whether that's in our mouth, our brain, wherever, our gut. That's when we start to see a lot of chronic illness creeping in and people struggling with their health.
And that's something that we can tell about your mouth too. Many of you may have silent reflux and not even know it. And I personally, I had it. I didn't know until I had an employee break my nose. That's a whole fun story on the side. It wasn't intentional.
Tell us that one.
And they scoped my throat. And when they were scoping my throat, just looking at my nose, they realized my whole esophagus, is that what you say?
Mm-hmm. Yeah.
The lining of my throat was so raw. And I didn't know. I didn't feel any pain. But apparently at night when I sleep, because, I never experienced stress, right? I guess my body was, and I wasn't aware of it. I had these acids come up my throat in the middle of the night, and it was eating away at the lining of my throat. So if you're waking up in the morning and you need to clear your throat and you feel that there's mucus there, or anytime throughout the day you're going to talk and all of a sudden you're a little nervous to say something because you might have a little mucus and you got to kind of clear your throat or go step away and cough for a minute before you can talk. That is a good indicator that you may have silent reflux and you're not even aware of it. And that can be very damaging long term. But also your dental exams can show that, because typically the back teeth are affected by that acidity. So we see more decay, more erosion of the enamel in the back of the mouth from that acid coming up at night. So if you have acid in the front of the mouth, If we see erosion on the back of the anterior teeth, that's usually a really good indicator of bulimia. We usually can't address that. It's a very delicate thing to address, but if you do suffer from that problem, there's so many great resources out there to help you find other avenues. But just be mindful if you do suffer from bulimia, that is eroding the back of your teeth. The enamel is sometimes completely gone, which exposes the dentin, which once it hits dentin, you're on a downhill decline to root canals. And we've already talked about root canals, so don't go there.
Avoid it.
Unless you want to choose your religion and choose which side you're on. But yeah, acid, there's a lot of contributors to that acid, and it really is the diet. But that mouth is the warning sign of, do you have acid reflux? Are you having acidic issues? And when we see dental breakdown, if you're getting a lot of cavities, your enamel, you're like, oh, I just have soft enamel. We hear that all the time. Oh, it's just hereditary. It's just genetic. I just have soft enamel. A lot of times that's your pH, your body's pH. You're too acidic. And it's either your diet or your stress. That's like the main two factors that we look at. And, your dentist can be a little bit of a therapist if we actually want to dive into that. Because we can look into your mouth and say, okay, how's your diet? If things are breaking down, and if your diet's good, okay, we know there's some stress. So it's like, how do we address that on the dental side and on the medical side? How do we address that stress? And that's one thing that we're working on through this podcast, in building healthy lifestyles that we'll get into in future episodes. Is how do we monitor those things? Because they are destructive. Short term, low dose, no problem. But long-term effects, if you're seeing a lot of cavities and breakdown in your mouth, that's a good indicator that you're having too much stress, or your pH is constantly too low by either food you're eating or the stress. Some medications, some toxins, things like that contribute to that as well too. So that's a really good indicator that something else is breaking down inside your body. If it's breaking down in your mouth, it's breaking down in your body. So be mindful of that. Yeah. So, we know, Dr. Seibold, we can go and get your dental exams. What we're learning as dental professionals and medical professionals, it is really important to combine those findings together. And, what are you looking for in these exams?
There's a number of things we look for. Let me say one thing real fast, too, that I think is really intriguing. So in 2000, the U.S. Surgeon General report on oral health came out, and they said that a lot of our chronic symptoms, that a good oral exam can reveal signs or symptoms of up to 90% of systemic diseases. And so I just think it's really amazing and kind of profound that.
So you said 90%? It can reveal up to 90%?
Correct.
Wow.
Yep. And so there's just a huge, there's a lot that we can learn from a good oral dental exam that will tell us about our systemic health. And so one of the things that I'm generally looking for is a big one is going to be for periodontal disease, right? This starts with like gingivitis with some inflammation of the gums, so redness, maybe some swelling around our gums, and it can progress to the point where our gums are receding away. We start to get breakdown of the bone, of the teeth themselves. And that periodontal disease is a huge risk factor for a lot of systemic diseases, in particular for cardiovascular disease. So that's one of the big ones that we're looking for. And people at home, if you're listening, if you brush your teeth or you floss and you're getting bleeding, that's a sign of periodontal disease. If you can pull your lip down or up and take a look at towards the base of the tooth, if the gums are kind of receding away, that's more advanced periodontal disease. If they're red and inflamed, that's periodontal disease. And that's something that you needs to be monitored. It needs to be treated, not just monitored, it needs to be treated.
Once it's there, it can be a very fast downhill decline in your oral health, the longevity of your teeth, and obviously the findings of your body's internal health. Yeah.
It comes back to that inflammation, right? So the periodontal disease drives inflammation and also microbial infection. Something called Porphyromonas gingivalis is one of the common implicators in periodontal disease. And so when we're seeing this chronic inflammation, that leads to systemic inflammation and opportunity for bacteria, for the bad guys, to be passed through the body. So that's one of the big things that we first look at. There's others. We certainly look for dental caries. Do we have halitosis, which is bad breath? That can signify a buildup of certain bacteria that produce sulfur, and they reside on the tongue and in the tongue fissures. we look at the general mucosa. How does it look on the roof of the mouth, around the gums, the tonsils? All those things really can tell us clues and give us some good indicators of where your systemic health is at.
Yeah, so I think just to make a comment too on that, like looking for caries, cavities, some of those things you're screening for. There have been some really fascinating studies that spirochetes, if you want to stay up at night or be worried about kissing, like we talked about earlier, YouTube spirochetes, there are tons of videos out there, and you will see spirochetes are like these little spider bugs, right, that swim through the gums like water pretty much and cause those periodontal breakdowns and wreak havoc in the mouth. And we've seen studies of, there's doctors that will do swabs and look under the microscope to see what type of bacteria is growing there. And we've seen studies of, a 20-year-old female, no cavities, great, gets a new boyfriend, and all of a sudden has a cavity, and they swab it and find these pockets of spirochetes there because these are transmissible through saliva. Sure. And now these studies are even showing these spirochetes they're finding in the brains of Alzheimer's patients. And that's like what we're talking about. Some of these diseases and things these bad bacteria that we're finding in the mouth can travel into the body and cause other problems within the body.
Sure. I remember there was a study done not long ago that they were looking at people who had acute strokes, right? And they took out part of the thrombus, and they would look at it, and they found strep viridans, which is a bacteria that's primarily located in the mouth. It's one of the pathogenic ones. And they started to make this correlation that, wow, even through different processes, and it's typically a process called translocation where you get inflammation, and these pathogenic bugs are able to actually get into the bloodstream, and then they kind of seed to different parts of the body, and the brain can be one of those. And so they'll even do different autopsy studies on people that have had brain issues or things like that, both kids and adults, and they've found some of these different microbes that are primarily contained and reside in the mouth. They found in different tissues through the body, and in particular is the brain. And we know that. Yeah. So we've done there's studies have been done on individuals who have Alzheimer's disease, and they found that those individuals tend to have more tooth decay and buildup of plaque than their healthy counterparts. So we're seeing that there's this very much a bi-directional relationship between the state of our oral health and chronic illness.
Yeah, and that's why, what is your mouth saying about you? And I know we've given you so much information today, but really when you're looking at your mouth, like I said, if you're seeing that overgrowth of biofilm or even able to scrape a little bit of that off, that is a good indicator that something's going on and that you're feeding that bad bacteria. Like you said, if you're seeing inflammation, that's a major indicator that there's something larger going on, like periodontal disease that can affect your whole body. The cool thing is that our mouth is this window, right? It's actually showing us a peek inside of our body so we can see how that microbiome is acting and how healthy it is. And it's right there in front of you. We can't look inside our body and see how this good and bad bacteria is acting unless we, go to you and get some tests and things like that done. But if you just open your mouth, there are visual indicators of, is your stress off? How's your diet? How's your nutrition? How's your stomach acidity, right? And just being mindful of nutrition and lifestyle. There's a bunch of really cool things we can dive into in another one. I won't include him on that one when we get nerdy with dental anatomy. But, the shape of your teeth show your genetics, which is pretty awesome. So I can look in a patient's mouth and I can know what ethnicity they are based off of different shapes and variations. So we can see your ethnicity, we can see your lifestyle, we can even see if it's stress and your diet and nutrition. And we're asking you to be mindful of that as well, as you have these visual indicators right there in front of you that are telling you, are you in a healthy state? Or is something starting to get thrown off a little bit that you should be mindful of? Or are things out of control and you need to take serious? And I think it's interesting that so many people invest money, and we live in Utah, so we've got the fake boobs and the fake eyelashes and, over Botoxed and frog lips, right? And it's fun. It's funny to see how people focus so much on those aesthetic coatings, those aesthetic areas instead of the teeth. Yeah. And how many people want to pay to go to the dentist and how many people want to pay to go to the doctor? It's usually because they wait until something's wrong. And by then it's really hard for us to get them back to a healthy state to repair that. Where if we can take more of a proactive approach, preventative approach, look at these warning signs and invest in your healthcare. Like functional medicine, he starts with the blood work, Dr. Seibold. And you can tell so much about a patient by looking at their blood work. But how many people are willing to invest in that blood work? How many of us are willing to say, okay, this car, I can save $50,000 on this car, $30,000, whatever it is, right? And that's going to get me 5 years, 7 years, however long that's going to get you. But how many of us are actually investing into our body, in our health, that we want to get more than 5 years out of? And so I would ask and encourage you to take a different look at your body, what your mouth is saying about you, and actually be excited to invest in dentists and getting your blood work and working with a good functional medicine doctor that's actually looking at the root of your health. Unfortunately in the US, our medical system, insurance-based systems, they just don't have the time to really look at what's going on in the body. And same with a lot of general dentistry. Dentists out there, if you're watching this, please pay better attention to what's going on in the patient's mouth. Educate them. People are hungry for information. You could really take that preventative approach early on and save them thousands of dollars later on in unnecessary work. And I'm sure he feels the same.
Same for primary care in traditional medicine, right? It's a 5-minute exam that you can get such a good window into somebody's health. And there's so many signs, symptoms, things that we can be looking for that can sure clue us into some of your things that you may be at risk for developing, help us to monitor these things more closely. And it can really just benefit you in so many ways.
Yeah, I also think it's, our oral environment is like our body. It's a reflection of how we feel about ourselves.
Sure.
Right? If we're neglecting our teeth, we're neglecting our body. But for sure, if our oral environment is failing, our health is failing internally.
And,
right?
and we know that if you're smiling, you feel better internally. It releases, there's how many muscles in your face that help promote a smile versus a frown. And we know that when we're actually smiling physiologically and neurochemically, different hormones, different neurotransmitters are being released that ultimately do aid in how we feel. So being able to smile with confidence and not being worried about your teeth and what they may be showing certainly will aid in how you feel. I fully agree with you there.
Yeah. So Dr. Seibold, we've talked about so many great things. Going back to vitamin C and nutrition, what are some things that we can really do to link nutrition and oral health?
Couple things. And actually, let me say one thing first. So in functional medicine, we tend to do really extensive testing on patients, much more than your traditional provider will do. One of the big things as far as like oral health, there are tests that we can do to actually look and see what microbes are actually inhabiting your mouth, right? You can't just take a swab and culture it. They don't grow that way. This is really done more through genomic data, looking at the gene sequences of these different bugs. And that can really help give you some clues as far as which bugs you might already be predisposed to. And if we know that if you have P. gingivalis or strep viridans or some of these other ones, you're at risk for potential, worsening periodontal disease and some of these other systemic problems, right? And there's also tests that we do that look at people's genetic factors that can help tell you what's your risk for having some of these things. If you have the ApoE4 gene, you're at higher risk for developing Alzheimer's disease than the average person is. So sometimes knowing doing some of these more advanced testing, we do hair samples that you can submit for heavy metal testing, can really help give you a much more in-depth look about your health and where it's at. So, but back to your question, as far as like nutritional health and that, really I think the big key is, and I tell this to most all my patients, regardless of what we're seeing them for, a plant-based diet is really, I think, key to good health. And not just plants only. I love meat. I love a good steak. I love chicken. I love fish, whatever. It's what's the ratios of these things that we're eating, right? And so as far as plant-based, the more bright, vibrant colors we have, the more of those, the more nutrient rich and dense that food is, and the better it's going to aid in our good health, right? We know that some people that consume really high protein diets are more likely to have chronic inflammation or high levels of inflammation. So that might be driving some of the oral problems.
I think it's a good note too, and I don't want to get on a whole different subject, But the high protein, if you're having liver and kidney issues, is usually a link to that too.
Or can be.
Yeah. So it's pretty interesting. I'll let you carry that back on.
No, so and more the more fiber in our diet. We know that fiber is extremely critical for feeding all the good bacteria down in our gut, and also for having healthy bowel movements and other reasons. But even in our oral cavity, sure, it's going to help feed those bacteria some. It's not completely digested then, so it may not help as much as in the microbes down in our gut. But the fiber acts as kind of like a cleaning or debriding agent to help with getting rid of the buildup of biofilm on our teeth and on our oral structures. We also talk often about time-restricted eating or intermittent fasting, right? The goal of that is to reduce inflammation in the body. That's one of the primary functions and purposes of time-restricted eating. And so looking at and implementing a lifestyle program like that is going to be very helpful. Making sure you have adequate hydration so that you're able to produce the saliva you need to help with digestion is also going to be critical there.
Yeah. So. We'll talk about intermittent fasting later on a different episode as well. There's a lot of great things with nutrition and diet there too. What about oral probiotics?
So this is definitely kind of a newer area of research. We hear a lot about probiotics, and usually we're talking about ones that are going to help with our gut health, right, down in our intestines. When it comes to oral probiotics, there is some good research that there are different strains that can be very helpful, again, to help promote a healthy microbial community, to help reduce inflammation, to help reduce the more pathogenic strains of microbes that we're trying to eliminate. There's really kind of four main strains that a lot of the research surrounds, and that's around lactobacillus, bifidobacterium, lactococcus, and streptococcus species, right? And so they've done there's a lot of good studies and research done on these different strains showing how they'll reduce inflammatory markers, how they can be antimicrobial, and helping to reduce that Porphyromonas gingivalis buildup. There's a lot of good evidence there. I would really caution people because sometimes we think that, I'll just take this probiotic and it's going to restore all my good flora. And that's actually, that's rarely the case, right? I would think of it as another kind of tool in your belt to really help promote the good flora. You still need to be doing these other practices of brushing and flossing routinely, seeing your dentist every 6 months to have that good, scraping of the teeth to get that biofilm off, right?
I know there's a lot of dentists now too that are implementing oral probiotic after cleanings to repopulate that good bacteria.
Yeah, you got to have the microbes. The microbes are good. We got to get rid of the bad ones, and we got to really promote a lifestyle. That variable microbiome we talked about that's going to promote the good guys.
Yeah. And 6 months for cleanings. If you have periodontal disease or other issues, we typically say 3 to 4 months.
Okay.
So
good to know.
There's also some connections with sleep, and we'll get into sleep in some of our other episodes as well. But one thing, if you're a mouth breather, that can be a huge. If you're having dental breakdown in your mouth breather, there are mouth tapes or other things to look at. I would suggest working with your doctor or an ENT to look at your nasal passageway and see if it's restricted, and that could be contributing to mouth breathing. But mouth breathing does dry out the mouth and has been linked to dental breakdown as well.
You talked about stress too, right? And we know that one of the best ways to activate or get rid of stress, to kind of deactivate that sympathetic fight or flight system and activate more of the parasympathetic, the rest kind of calm down system, is through nasal breathing. Nasal breathing also promotes production of nitric oxide at the back of your tongue, which helps to dilate blood vessels and gives you better blood flow. There's a lot of really important factors or I guess benefits of breathing through your nose. The air filtration too, right? That's why we get nose hairs. They get gross as we get older, and they stick out your nose. You got to shave them, wax them, or whatever. But they're there for a reason. They're there to filter
so
the
just trim the ones that are visible and leave the ones that are not.
Exactly, right?
Yeah, sleep apnea too, we won't get into because that's like a bunch of different religions. There are a lot of philosophies, a lot of variables for sleep apnea. We will talk about it some in our sleep episode. But if you do have problems with sleep apnea, see a specialist. But also work with a functional medicine doctor, work with Dr. Seibold, because the dentist alone, they can track some things, and some dentists are getting very specialized in sleep apnea, and that's great, but there's so many other things going on with the body that need to be examined and evaluated, and there's so many different contributors to sleep apnea, from weight to altitude induced to, the oral environment and structure to structure of airways, that we'll get in that in another episode. But I do encourage you to please seek out someone who is really specialized and qualified in that area, because there's a lot of treatments out there that may cause more harm than good when it comes to sleep apnea. There's also some miscellaneous treatments and things that we can do to increase oral health.
Sure.
Do you have any other tips?
Well, a couple simple ones. Chewing xylitol gum really helps to promote a healthier oral environment, helps with saliva production. Sometimes supplementation, different enzymes, coenzyme Q10 can be helpful if it's low. I would probably recommend checking it first before you just start adding it to your diet. Some people will do different herbal tonics that really help to promote, again, the healthy growth of that healthy microbiome. Oil pulling is another one some people do.
Yeah, oil pulling. Yeah, that's there's all different religions like we talk about. Oil pulling, it can be great. We're seeing some new studies on it that are showing that, coconut oil can coat the teeth and it helps promote healthy bacteria and eliminates the production of bad bacteria. You just want to be mindful if you get into coconut pulling. It is not an excuse to not floss. You still need to floss. Use a good floss. Some floss, once again, when you're flossing, if you're using something that contains toxins and chemicals, especially chemicals, as soon as you place that floss between your teeth, those chemicals are getting straight into your bloodstream. So use a good non-toxic dental floss. But this coconut pulling, some people use an excuse to not floss. It's not good enough. You still need to get in between your teeth. It's like saying you vacuum the carpet but missed underneath the couch, right? Like you've got to floss no matter what, at least once a day, please. We always joke around and say, floss the teeth you want to keep. So, but oil pulling, if you do use it, it's weird because you have to let it melt in your mouth. And so it's like a hard substance at first. And then, they recommend up to 20 minutes. So 10 to 20 minutes of just swishing this around and swishing this around. So it's a different feeling at first. I think most people that use it all express that they feel great. And they do tend to have pretty healthy teeth from what I've seen so far in the studies that have come out. Do not spit it down the drain. That's one thing we need to know. It needs to go in the garbage because it will harden again, solidify, and clog your drains. So make sure it goes in the garbage. But so far we're seeing pretty good results on some of the studies with coconut pulling. Yeah. So to summarize, hopefully you've gained some valuable tools and information on how to analyze what's going on in your own mouth. Take it serious, like I said, because little indicators in your mouth could be big preventative indicators. It can take a big preventative approach in your overall health. So pay attention to what's going on in your mouth. Work with, like I said, functional medicine. I cannot stress that enough. We all like vitamins and supplements and things like that, but one thing that they do is they look at the blood work and see what actually you need, what's going on in the body, and learn how to customize vitamins or supplements or whatever specifically towards what we need. But just getting to the root of our health, or if you're healthy, how do you enhance that now and get to peak performance, which is, I feel like with all the technology and information we have out there nowadays, there's no excuse why we can't all be superhuman, super healthy, right? I think it's the stress and lifestyle stuff we'll talk about later that factor into that. So
I think what you said there is actually right on the spot. I was just thinking about that I think it's so cool that the day that we live in, there's such cool technologies out there. The fact that you can take a look and see what bugs are in my mouth, what are my genetic susceptibilities or propensities that might lead me to different chronic illnesses that I don't want to deal with later in life, right? There's a lot of really cool stuff out there that we can use to help give us information, to help point us in the right direction in regards to our health. I love functional medicine because it looks at what's the root cause, right? Traditional medicine too often is set on, here's a diagnosis and here's some medications to manage the downstream symptoms of it. And we don't ever usually spend time getting to the root cause. And that's what I love about my job is that I get to work with people who really are invested and want to be active participants in their health. And we look to see what's that root cause. And we try to make foundational lifestyle changes that are going to help people to live their best, their healthiest, their most active, vibrant, energetic lives, the lives that we all want to live, right? This isn't something that we can just take a simple pill and just fix and correct. This is something that takes effort and repeated trial and error and really dedication and commitment to living that healthy lifestyle. So I just think, our oral health can be such a great way or great place to start and look as far as what does my systemic health look like? Does it tell us everything in the world? No, but it's a great starting point. It certainly should be something that is included in our our traditional exams and evaluations and a bigger part of what we do in medicine. But I really love this collaborative effort because I do think, unfortunately, too often in medicine, even in my traditional medical field, right, there's not enough communication between different specialties, medical providers, and adding between dentists and medical doctors, both also very helpful.
Yeah, it really gives dentists the opportunity to take a preventative approach. Everyone should go to the dentist every 6 months for cleanings. And if dentists can start screening and looking at those indicators and take a preventative approach of what's going on in their entire body with some of those visual signs that we see in the mouth and collaborating with doctors, we can actually catch things at an early stage. And I know a lot of dentists now are catching on to this, and it's exciting to see how we can tie dentistry and medical, especially functional medicine, together and really take a preventative approach and be in tune with what's going on with our patients, and as a patient being in tune with what's going on with ourselves. So I just wanted to thank Dr. Seibold and Forum Health. Forum Health has been an incredible support in teaming up with us here at Capture Dental Health and Beauty Center. They are publishing and posting so much good stuff. I'm not a huge social media fan. I do get on there and obviously for business, sometimes for myself, but they're posting a lot of great information, daily information on your diet, your nutrition, disease. They're all doing this, everyone at Forum Health, including Dr. Seibold. So check out forumhealth.com. They have webinars, a wealth of information on their website, from sleep to all kinds of areas that encompass overall health. In addition to their social media, Forum Health on Instagram and Facebook, they're posting daily things to help us live a healthier life. So I just want to thank him again for joining me. Hopefully we've simplified some areas of oral health and the connection between your mouth and your body, and maybe taught you what your mouth is saying about you. Like I said, go do that finger test and scrape around your gum line and then give us a call and we'll talk and help you figure it out. So we look forward to having you join us on our next episode that's all about our lifestyle. What does our lifestyle say about us? And then we'll be diving into all other aspects, from sleep to nutrition to exercise to finance, relationships, on this series of A Healthy Life Simplified. Thanks again for joining us.
Thank you.